You know, if you're one of the 12 million Americans who suffers from sleep apnea, you know how hard it can be to get a good night's sleep. A new approach, though, first developed 2 years ago at the Ohio State University Wexner Medical Center, could bring relief. Doctors are now testing a pacemaker-like implant with impressive results.
There was a time when Leslie McGuire would dread going to bed. Because of his sleep apnea, Leslie felt exhausted most of the day, and at night, it didn't get much better.
Before I was diagnosed, I would wake up probably 5 or 6 times a night, sitting on the side of the bed, gasping for air.
For many, wearing a breathing mask at night can help, especially for those with obstructive sleep apnea, in which the airways tend to close. But the mask didn't work for Leslie. He has central sleep apnea, and when it came to finding a treatment for him, time was of the essence.
This form of sleep apnea is particularly dangerous because it's associated with patients just stopping breathing periodically.
Dr. William Abraham is a cardiologist at the Ohio State University Wexner Medical Center. He says while we're sleeping, the brain continues to tell the body to breathe. But in central sleep apnea, that signal is faulty. So to help those patients, doctors at Ohio State are implanting a pacemaker-like device just under the collarbone and running a wire to the patient's diaphragm. At night, that wire signals the diaphragm, prompting patients to breathe.
What we saw were remarkable results, more than a 50% reduction in the number of events occurring per hour, and more than a 90% reduction specifically in those events related to central sleep apnea.
It worked for Leslie, who says he now sleeps through the night and has more energy to spend his days with his wife.
Besides her, this is the best thing that's ever happened to me. Everything has changed. Everything is so much better.
Well, that sure is good to hear. Doctors at OSU Wexner say the device is also effective because patients don't have to do anything for it to work. Once it's turned on, it works automatically. Doctors hope to use it to treat patients nationally in the coming months. And you know, we first told you about the sleep apnea implant in 2011 when Dr. Abraham first started testing it. Visit 10tv.com/health to watch our previous story.